I have invited our esteemed professor, Laura Geyer, and Laura will talk once again. She spoke in November, I believe, right, Laura?
We
Uh,
had an informal roundtable, I think.
yes. So this time, Laura will give the presentation for half an hour, and after that, we'll have a lively discussion, I hope. And I wanted to include especially Anna and Gigi with Laura in that discussion. So they'll be highlighted.
Well, I want to
Okay.
thank all of you for inviting me. Let's see, have you given me permission to share my screen, Jeff?
Yes, you should have permission.
Well, again, I appreciate the opportunity to talk to you about something near and dear to my heart, and that's the community that we live in. So I'm going to share with you some data. I'm going to also share with you some graphs that will help you see kind of the state of Gainesville with the haves and the have-nots. Just three simple learning objectives here tonight. First of all, I want to talk about the social determinants of health. When you talk to people in healthcare and public health, you're going to hear them talk about the social determinants of health. And these are the non-medical factors that are associated with our health and well-being. So the social determinants contribute to our quality of life and quantity of life. Then I want to take a look at Alachua County and the Gainesville community to see how the social determinants of health and zip code predict both good health and health inequities among residents. And then we're going to have a conversation. I do want to limit the amount of time that I talk because really I've put this presentation together with you in mind, hoping to give you some data and some concepts to chew on long after I've finished this presentation. So as we take a look at this line graph, you can see that it's divided by different population groups. We are small and informal, and I like to have people contribute to the conversation. So which group would you rather be in when you take a look at this line graph? Who does it look like lives the longest?
White
I
and
guess
Hispanic females.
Hispanic females at 84.3 years. And which group looks like they have the shortest lifespan?
non-Hispanic black males, yes.
71.5. Can you see that we have almost a 13-year difference?
Well,
Isn't that huge?
quite a range.
And so, we look at this line graph and say, well, this is looking at the US, and lots of big numbers. And we probably don't see this kind of difference here in Alachua County. Well, I'll tell you, we don't see 13 years, but you might be surprised at what we are going to look at in just a few minutes. So the social determinants of health. These are the conditions that people are born, grow, live, work, and age. This is where they play, where they die. Basically, we're thinking about their neighborhoods, the communities that people live in. And we know that the social determinants are shaped by the distribution of money, power, and resources at local, global, national levels. Certainly, social determinants of health affect every single community, every single nation. They correlate strongly with the given health status of a community. And what research is showing us is because when we talk about the social determinants of health, we're talking about neighborhood and community. We can also think about the ways that we describe our communities with zip code, right? So zip code, in fact, in the research is becoming a more powerful predictor than genetic code. So zip code, not genetic code, is really a very good indicator of your quality of life. When you think about the categories, there are 5 different categories or domains that we think of when we talk about the social determinants. And if we take a look at this nice graphic, you can see that we talk about healthcare. Okay, so that's one area. We talk about the neighborhood and the built environment. We talk about the social and the community context. And this is where factors like discrimination and racism come into play. We talk about economic stability of communities, and we talk about education access and quality. So as you think about our community, Alachua County, and specifically the city of Gainesville, and you think about the different neighborhoods, the different communities, and you think about these 5 different areas, if you can kind of keep this model in mind as I go along, I think this presentation will make more sense. This is one more way of thinking about the social determinants of health. I don't know if you're familiar with the Robert Wood Johnson Foundation. Annually, the Robert Wood Johnson Foundation ranks counties, every single county in the nation. I've embedded the website in this presentation, and Jeff, I'll be happy to send it to you later so that all of you will have it. You can look up Alachua County and see how we compare to all the other counties in the state of Florida on a variety of different factors. But let's take a look at this model, because it takes what I just talked about and it kind of organizes the information a little differently. So you can see at the very bottom here, we start with the policies and the programs. So as you think about Alachua County and you think about how our resources are distributed, well, certainly power is a player, isn't it? When we think about who gets resources and who doesn't get resources. Now, we call the policies and programs the political determinants of health. And the political determinants drive the social determinants, because the political determinants drive the distribution of resources. The health factors, okay, in the middle, again, organized a little differently, but we think about the physical environment that people live in with their neighborhoods. This contributes about 10% toward health. So we think about the air and water quality, and we think about housing and transportation. We think about the social and the economic factors, and this is really where I just kind of showed you that picture from the social determinants of health. So we talk about education, employment, income, family, community safety. That contributes about 40%. So look at this, you add them together, the social economic factors and the physical environment contribute about 50% toward our health outcomes or opportunities for health. The clinical care that's provided by physicians and dentists and mental health professionals and other allied professionals contributes about 20%. And here we're talking about access to care, and certainly access is something that we have been talking about a lot in our community recently. And then the health behaviors that people engage in contribute about 30%. So the health behaviors, the clinical care, again, that's the other 50% that contributes toward our total health. Premature death. All right, the factors that are associated with death before the age of 70. And if you think about that line graph that I showed you, everybody was above 70 years, but there are some factors that contribute, okay, toward a shorter lifespan. Certainly genetics is a player. You want to pick your parents wisely, correct? Because that's going to be the starting point for ensuring your success in life, right? Is picking your parents. Because your parents determine the neighborhood. They determine the economic, the social, the educational environment that you're raised in. Probably the values that you're raised with. Individual behaviors also contribute to premature death. It's social environmental factors. You can see that they don't contribute the same amount, and healthcare contributes even less when we're talking about premature death, because we're factoring in genetics. So when we talk about health equity, what is health equity? What is health disparities? So we can think about health equity as equal opportunity, okay? Equal access to available care for equal need. It's equal utilization for equal need. It's equal quality of care for all. So we want to ensure that all members of our community have equal access, equal utilization, equal quality when they need care. Now, health disparities are health inequities. We don't use the word inequality because equality just means equal. Inequality means unequal. Health disparities are not just inequalities, they are inequities because there is an element of unfairness associated with the fact that we see differences. So Healthy People 2020 described disparities as a particular type of health difference linked to your social, economic, or environmental disadvantage. And there are certain populations within US society that are systematically disadvantaged in the health arena. We talk about the social gradient of health. We know that unfortunately in our society, just like in fact, honestly, every society, some groups have greater value, some have less social value. When you are a valued population, that's going to be associated with more power, more access to resources, probably greater resources that you yourself have. You have better quality and quantity of life and better health. I want to point out something though. The same populations that suffer from being at the low end of the social gradient of health, these are the same unfortunate populations that are at the receiving end. They are at the low end of the social gradient of education and the social gradient of social services and the social gradient of disproportionate incarceration. Health disparities describe, and you can see the different communities that are mentioned here in this second part of the definition. When we think about race and ethnicity and language and immigration status, socioeconomic status, education, gender identity, sexual orientation, age or the generation that you're part of, your religion or spirituality, disability, geography, are you rural, are you urban, are you North Florida, South Florida? All of the, do you live in a large county in Florida? You get more resources than if you're in a smaller county. So where you live matters. And the US is a nation of zip codes. Zip code's more important than genetic code, and the research is pointing more and more strongly in this direction. We know that where we live plays a critical role in our health, our access to health, and our opportunities for health. Living in a poor neighborhood is bad for your health, short term, but also long term, because when we think about children, let's think about the children who live in our community right now, who live in the zip code areas that are low income. Those children have less access to resources of all kinds. They are being disproportionately disadvantaged now. And if they're living with chronic hunger, which is toxic stress, or there's violence in the home or in the environment, again, when we think about the cumulative effect of stress from not having what's needed, these children are impacted at the cellular level and again, disadvantaged for the rest of life. There is a cumulative effect of poor socioeconomics and living with chronic social stress. So here's Alachua County. We are a county full of zip codes. I want you to take a look at this map right here, and I'm going to call your attention to 32609 and 32641. These are the two largest zip code areas in the city of Gainesville on the east side of town. I'm going to be sharing statistics with you from West Gainesville, and I've selected 32606 zip code area, which is area of Santa Fe College and out toward Tioga, and also 32608, because this is actually two very interesting communities. 32608 includes Hale Plantation, but it also includes the Swag community. So we're going to be taking a look at some health statistics in 32609, 32641, 06, and 08. All right, so we looked at a line graph as we got started. Looked at longevity differences based upon membership in different racial and ethnic communities. I'm going to go to, here we go, here's Westside Baptist Church is 32606. Here's 32641, which is where the health department's located. 32609 is where Fernside Clinic and Metcalf Elementary are located. 32607 is SWAG, 32608 is Kanapaha. My error that I thought it was, that SWAG was in 08. So those 4 addresses from the 4 quadrants of town. Which quadrant of town? Okay, here's national average for longevity, 78.7 years. Florida average, a little bit better, 80 years. Alachua County, right between the two, 79. But by zip code, which quadrant of town would you like to live in?
Northwest.
Yeah. Which quadrant has the shortest lifespan?
Northeast.
Yeah. By how many years?
7. 7.
8
Yeah.
actually.
Yeah. So we're not looking at the same 13-year spread as we did with that first slide. But I think 8 years, 7.5 years is a significant amount of time, don't you?
Yes.
Mhm.
I think it's sobering when we can look at numbers. And in a few minutes, I'm going to show you some charts that are, I think, just extremely eye-opening and very sobering. A picture's worth a thousand words, right? All right, so let's continue. I have been in this community a long time. I came here as an undergraduate student and never got out of town. I didn't stay in Gainesville because I loved the place. I stayed in Gainesville because I got married and the person I married loved Gainesville. But what I discovered once I left university life as a student and started working as a health professional was that there was a side of Gainesville that was just amazing. We have, and I know that all of you know this, we have the most amazing people in this community. They are giving, they are generous, they are farsighted, they want to make a difference. In 1987, I was a faculty member in IFAS. I was actually directing the dietetics program that I graduated from. At that time, there was a study that was published. It was unofficially known as the Harvard Hunger Study, which is what I've given the caption. But Harvard University engaged in a study where they ranked the 150 hungriest counties in the United States. And you know what? We made the list. Alachua County was ranked number 97. That's 1987. We still have children going to bed hungry and adults going to bed hungry, don't we?
Laura, 150 is the most hungry?
That would have, I don't know which way it went. I would think so. No, I would think 150 would be the least hungry, 97, and probably number 1 was the hungriest.
Okay.
Oh, okay.
But we made the list. How many?
Yeah, we made the list.
How many we have 67 counties in Florida alone. So we're looking at some like Georgia has more, about 100 counties. Some of these states have lots of counties. So they're looking at all the counties. Okay, that was 1987. We have a vision statement in Alachua County. Alachua County is a place where everyone can be healthy. That rings very similarly to the definition of health equity, that it's a place of equal opportunity where everybody for equal need can have, equal access to care. What we found, as a faculty member, again, I'm engaged with the community. I like to involve students who are preparing for health careers, undergraduate, pre-medical, pre-dental students in our community projects. So every 3 to 5 years, we have to complete a needs assessment of the community and look at, from the standpoint of health, what are the needs in our community? What we found in 2016 was that we have a number of marginalized communities. So we're talking about communities of people who experience dire healthcare needs. They don't have access to care. And healthcare and prevention are not priorities. These are individuals for whom utilities is one of the biggest problems. trying to maintain, a livable wage, working maybe 2 jobs and feeding children. And we have some dire, situations in our community. And I'm not telling you all something that you don't know. What I also discovered in 2016, because again, I had students out passing out surveys to people, and we went to the communities where people didn't have access to computers and where they needed help with reading, because we went to the communities that were underserved. We wanted to know what people who wouldn't be likely to participate in a project like this, what they had on their mind. We found that when we would ask people, hey, we have a survey, we'd like to know what you think about, health in our community. We want to know what your needs are. Would you be willing to give us a few minutes and, we'll make it go fast. We'll read it to you. People would often say to the students, so if I give you my time, is my information going to help your community or my community?
Ooh.
Going to help your community or my community? How many of us think about Alachua County or Gainesville as our community? But you see, it's important to realize that we are a community of communities. And it's not until we become mindful of the communities that we really will be able to achieve health equity. Now, this is a table. It's a little bit busy. You can see that I've highlighted the zip code areas that I told you I wanted to call attention to. 06 is northwest, 08 is southwest, 09 is northeast, 41 is southeast. And I'm going to take this information and show it to you in another table in a minute, but for just sake of comparison, there's more information here. You can take a look and see by race and ethnicity, as well as by language. Do people speak English only? I haven't included all the other languages that people speak. We can get a sense of the median annual income, the average household value, the percent of population below poverty, and the percent of population that has a college degree. Certainly, there are many more demographics that I could have reported, but I chose these for the sake of this comparison. Let me show you an easier way, perhaps, to look at this information. East versus West Gainesville. So these data are taken from the 2015 Envision Alachua Task Force. Here's the link if you want to check this document out for yourself. Information's, it's a little bit old. It's 2015, but I'll tell you that the comparisons, haven't changed that much. So if we compare East to West Gainesville, you can see that when we talk about average income, we're almost doubling when we go to West, or maybe we could say we cut in half when we go to East. You can take a look at the educational attainment, because that's a powerful predictor of socioeconomic status, job opportunity. This is what James Lawrence, this is what I shared with him that he commented on in his editorial. When was that? I guess that was in October. When you count the health clinics and urgent care centers and compare them between East and West Gainesville, it's just unbelievable. So this doesn't look too bad when you say, okay, 33 in West Gainesville, 12 in East. What, 12? I didn't think there were 12. Well, here's what's important to realize. 10 of those 12 are clinics that are operated by the University of Florida Equal Access Clinic or Mobile Outreach Clinic. Do you all know what those two clinics are?
Mobile units that only show up every so often.
Right. So the Equal Access Clinic goes to, for example, Bartley Temple one night a week, and they're open for like 2 or 3 hours. So that counts as a clinic. So and the mobile bus goes again to different parts of Gainesville. When it goes to East Gainesville, again, it has a circuit that it follows, and it'll go to a location and be there for maybe half the day and then go to another spot. So when we are talking about actually brick and mortar clinics that are open, we're talking about 29 clinics on the west side of town and 2 on the east. Now, I can give credit for one more on the east because UF Health Main Street Clinic is a brick and mortar with faculty, physicians who staff that clinic. It's right there on the dividing line of Main Street, and it's on the east side of Main Street. So I could actually give credit for one more and say we have 3 on the east side of town, but folks, that doesn't compare at all to what we have on the west side. Let's look a little more. All right, so here we can see, this is actually a visual that was put together by UF Health. And so it's showing hospital-associated care, and you can see the numbers, and I've identified Main Street for you. It's right here, okay? Right here is Main Street. Can you tell me what you see on the east side of town when you look at this picture?
Nothing.
Right. Let's look at another picture. So I Googled, because again, community is my area of interest. I love this community. I Googled health clinics, I Googled urgent care clinics, and I Googled emergency care clinics. And all of them aren't listed, but you can get a pretty good idea from looking at the picture. So here we go. Health clinics. And here we have Main Street, okay? And what do you see? East versus west.
1, 2, 3, yeah.
And another picture. Urgent and emergency care. I know, again, UF Health interested in a lot of dialogue, urgent care, emergency care, primary care. Folks, when you don't have care, you need everything, right? But again, let's look at the picture. Here's Main Street. Okay, it's this little gray line here. What do you see for urgent care and emergency care on the east side of town?
It's nothing.
I use Publix as proxy for the middle class because I think it is a pretty fair proxy. I think it's accurate. I mean, Publix does a needs assessment. They do an economic survey before they, put up a new store. And if you've been in Gainesville for any period of time, you know that in Gainesville, Publix goes right up to Main Street, the dividing line, and it's on the west side of town. So it counts as west. Where do people buy fresh fruits and vegetables when they live in East Gainesville? And we know that the grocery store that we were hoping for isn't coming.
Right. Walmart.
Right, exactly. But but that's in the northeast quadrant.
Yeah, it is.
If you live in southeast Gainesville and you don't have transportation, where do you go? I mean,
yeah, and there's so many people in the Northeast. I live in the Northeast.
Yeah.
They're riding bikes and walking. I see them all the time. Right. So how are they getting over to the west side to even go to a hospital or a clinic?
Yep. And I don't know if you're aware of how long it takes. My physicians are at Spring Hill, which is out here by Santa Fe College, UF Health Spring Hill. I was in the elevator with a gentleman. I always talk to people in elevators. I'm kind of weird. So, hey, who are you? And he was saying, well, I live over in, northeast Gainesville. And I said, oh, really? And he said, yeah, I took the bus to get here. I think he had to change buses twice or maybe 3 times. It took him more than an hour one way just to get over to the clinic.
And those only run during the day. At night,
Exactly.
A lot of those bus lines close down.
Sure.
Yeah.
And if he has an accident, we just looked and saw that there's no urgent care he can go to.
Mhm.
So, you know,
And-
again, when we look
yeah.
at pictures, it paints a picture that the numbers alone don't convey. Access to quality education. So these are the elementary schools.
Mhm.
And, you know, I know when I've shown this picture before, people have asked, well, how many people live in East Gainesville? It's true. We have more people in West Gainesville. But again, take a look, though, at the distribution of schools, elementary schools. All right, now, here's what I want to do. I want to compare, I want to take a look at, by those same four zip code areas, I want to tie reading assessment or literacy to health. Okay, so right here, we're going to start by first looking at the 2021 reading performance. We know we do that assessment in third grade, right? Scores range from 1 to 5. 1 is inadequate, 5 is mastery. Why is third grade so critical? Well, you have the first 3 years to teach children how to read.
Mhm.
And after third grade, in fourth grade, the curriculum changes and it becomes language-based. You start getting word problems in math. The science becomes more advanced. The history becomes more advanced. So those children who aren't reading proficiently, who haven't mastered reading or language arts, by the end of third grade are going to fall behind. And it is an exponential fall behind that they never catch up. It's an exponentially, it's impossible. So we can take a look at reading performance here for the percent of students that were reading, okay, that their reading was inadequate. And where do we find above 50%? Well, we find at Rawlings, Northeast and Southeast. So again, we can go to the Southeast, we can go to the east side of town. Let me point out something. Right here, I'm looking at Metcalf. I want to point out a factor. I've been looking at these reading scores for a couple of years now. 3 years ago, Metcalf had the lowest reading scores in the county. I can also tell you that Metcalf something is going on at Metcalf, because Metcalf was also listed in the 10 worst performing elementary schools in Florida. I think it was in 2019. So the fact that you're seeing this number right here, something very good is happening there at Metcalf. All right, the University of Florida College of Dentistry goes into all the elementary schools and screens the oral health of children to see how many, there are a variety of factors they look at. But here I want to, by zip code, look at, now we're going to look at mastery. So the percent of children at mastery, when you have a 0, that's a bad thing, because that means none of your children have mastered reading, okay? Now take a look and compare to the percent who need urgent dental care. And I've highlighted those schools where we have at least about a third of the children who have critical oral health needs. And you can see that for the most part, those are the schools where, again, they're not reading as well, because there is a direct relationship between literacy skills and health.
Yeah.
You might wonder, well, so that's for the children. What about for the parents? So UF Health has a UF Health community dashboard. There are some chronic diseases and other factors that are where statistics are listed by zip code. So I've pulled some of those for you to take a look at. Some of these are physical health, some are oral health, some are mental health. As you take a look, for example, at the ER rate due to alcohol use, opioid use, here we have hospitalizations that could have been prevented. We can look at adult suicide and intentional self-inflicted injury. And where do we find, again, the areas of the community where the needs are the greatest? Again, we can go to the east side of town. Now, everybody who grows up in a community without resources doesn't end up with chronic disease and a terrible health outcome, because there are protective factors. We call this personal resilience. You can build social factors, social support, self-esteem, self-efficacy, and you can mitigate some of the damaging effects of a poor environment. It really troubles me to know that I right now could go to the east side of town into a 3rd grade class, and here it's toward the end of the year, so children are going to be taking those reading assessment tests within the next few months. And based upon the scores that the children get, I can predict when you're 10 years old what your future is going to hold. Because the research does show us that when you don't read, you are more likely to drop out of school. When you drop out of school, you have less economic opportunity. You perhaps abuse substances. You may engage in crime. You may be more likely to be incarcerated. And you see, I'm talking about children right now who are only 10 years old. I know we live in a community that cares. And I know it's not too late to intervene. But the only way that this is going to happen is for organizations like the League of Women Voters to be aware of the data and find a way to engage in either with an organization that's currently involved with intervention, or consider how you can get involved yourself. So you can get additional data from the community health assessment. It's published, it's online. I'm happy to give you the link if you need the link to look it up. It's required every 3 years for nonprofit hospitals, every 5 years for the health department. We in the community take the data here, we look for the themes, and we put together a health improvement plan. So our CHIP is looking at tobacco and substance abuse, and there are several other. We're looking at oral health because we have a lot of oral health problems in our community. So we would certainly welcome members of the League to be part of our steering committee next time. Also, Gainesville for All. I'm going to put in a plug for someone I respect and admire, and that's James Lawrence. He's been here for 5 years, came here in 2015, and launched an organization that's making a real difference. So Gainesville for All, established to shrink the gulf, okay, to help eliminate the disparities. And Gainesville for All is establishing, and I'm hoping this is still on track, even with the shakeup that we've had in our school board. They have the Gainesville Empowerment Zone which is at the 32609 zip code area. They're going to be establishing a family learning center, okay, at Metcalf Elementary. And the purpose of the learning center is going to be to work with women from the time they find they're pregnant all the way through their pregnancies, to support them, to teach parenting skills, to be a resource for children, for enrichment, and to be a resource for families. Because you know what? We can't leave our families out. The Rural Women's Health Project. Did you know that everybody doesn't speak English as their first language in this nation? And did you know English is not our national language? We don't have a national language. What does it mean when you don't speak English? Well, it means that you're left out of participating in parent-teacher meetings. You're left out of participating in healthcare. You have barriers to social services. Did you know that in our community, the top non-English, the top 5 after English and after Spanish, Haitian Creole, Korean, Mandarin Chinese, Arabic, and Hindi? Did you know that? 14% of our residents speak a language other than English. So the Rural Women's Health Project has been working for the last year and some with the Gainesville Immigrant Neighbor Inclusion, or the Ginny Initiative, and they're preparing to make a series of recommendations to improve access to services and programs for those who don't speak English as a first language. They have a list of recommendations that I'll send this presentation so you can take a look. And I'm going to invite you to join us because we're going to be meeting at the Matheson History Museum on March 29th. We're going to be rolling out, our plan to local leaders. Up to 100 people can join us at the event. So here's the invitation, and I'm hoping some of you will join us. Because folks, here's the goal. You know, we can argue all day, and our political parties do a very good job of that. Do we give everybody the same thing because that's fair? Or do we give some people more because they come from a place of disadvantage? They didn't pick their parents as wisely. Our political parties argue about it. Here's what I want to do. I want to do what's just and fair. You know, we need to have barriers. We need to have boundaries. We need to have laws and rules. They keep us safe and they provide order. But you know what? When we can reduce the amount of obstruction, and make it as easy for people to access as possible by removing barriers like language, for example, we make it easier then for people to participate in healthcare. So that's my presentation, and I know I want to turn this meeting over to all of you for conversation because I was here honestly just to get the ball rolling.